One effect of the COVID-19 pandemic that hasn't been talked about much is the effect on public hospital waiting lists. We've seen, as a result of the elective surgery ban and the public sector struggling to cope with COVID-19 patients, that many services have simply not been available over the last few months. And that will lead to a very significant blowout in public hospital waiting lists over the next couple of years. We're not expecting the states to catch up until at least 2023, and we expect that wait times for common procedures like joint replacements and lens replacements for cataracts may exceed 1.5 years. In fact, we're even seeing some media reports that suggest that wait times could be up to 10 years if you include the time taken to see a specialist in outpatients. This is clearly not acceptable. One way the federal government could help reduce waiting lists, in fact, the most effective thing that it could do to reduce waiting lists would be to restore the private health insurance rebate on premiums to 30%. For many years, low and middle income earners were helped to afford private health insurance by a 30% rebate. That's now declined to 25% as a result of federal government cuts. And in fact, they're forecasting to cut a further $710 million out of private health insurance in the next 4 years. That $710 million could fund 60,000 surgical procedures without a wait time. This would take massive pressure off public hospitals and help them to catch up as people were able to access surgery in the private sector. We're calling on the federal government to restore the private health insurance rebate before there's a crisis in elective surgery waiting lists.